Hi everyone, it's Mike Putman from the Medical College of Wisconsin reporting for Room Now from ACR Convergence 2023. Now today I'd like to tell you about some very interesting and exciting data from the Arctic Rewind study. They presented their 3-year data, which was abstract L07, partially this morning during the session for the ANR and ARD journals, and then also as a late breaker. Now this is a very important study. It was an open label, pragmatic, randomized controlled trial that assessed various types of tapering or discontinuation of disease-modifying drugs for rheumatoid arthritis. This is a very important clinical question, one that I think all of us have all the time. I have a patient with RA, they seem to be doing well. Can I taper or stop something? These investigators from Sweden set out to answer that question. Now, today they presented a couple of different studies, but the one that I want to talk about right now is the 3-year data. So patients who were on a TNF inhibitor were either stopped, they did sort of a slow taper thing, or continued on their TNF inhibitor. What did they find? Well, at 3 years, out of 80 people who completed the study, 25% of people who were in the tapering study had flared, or were flare-free, as compared to 85% of people in the long-term continuation study. That is a big delta. That is a 70% difference in the rate of flares if you continue or don't continue. Now, patients who were in the tapering group also required more steroids. 23% wound up needing steroids compared to 13%. So at face value, that's a pretty strong case for continuing TNF inhibitors long term. I often do that in rheumatoid arthritis, so this sort of confirmed my biases, and I think it's a reasonable thing to do with numbers like that. Now, the flip side is that if 75% of people flared at 3 years, that means 1 in 4 people who went off TNF inhibitors were doing just fine. And if you were a patient who did not like being on therapies, did not appreciate being on an immunosuppressive therapy and hoping to come off, there's a 1 in 4 chance that discontinuing a TNF inhibitor, 3 years out, you would still be doing just fine. Also, those patients who did flare, most of them, 67, so 2/3 of them, were able to reattain remission at the very next visit. So the cost of a flare isn't necessarily life-threatening, permanent loss of disease control. In fact, it was relatively amelioratable. And so my conclusions from this are that the treatment of tapering off of TNF inhibitors in rheumatoid arthritis has to be based on patient preferences. Some patients may plausibly want to continue therapy long term, and there's very good justification for that. On the flip side, 1 in 4 patients could probably do just fine if they tapered, and in that case, if they flared, you could probably get control back. That's it for this abstract. I think it was a very interesting one, and thank you for following all of our coverage on Room Now.